from North Valley College. I'm here today to interview you about your health status. So, how would you like me to call you, ma'am?
Maria.
Okay, Maria. I just checked your information. How old are you, ma'am?
I'm 18 years old.
18 years old. Where do you live?
Barangay Lanao, Quezon City.
Okay. When is your birthday?
January 21, 2004.
Your civil status?
Single.
Okay. And let's go to the interview. What brings you here to the clinic, ma'am, Mariel?
I have a headache.
Okay, a headache. So, a headache. When did this headache started?
2 days.
2 days ago. Can you point me where the area it occur?
Here in the middle.
So, in the middle. Does it only occur in that area or it radiates?
Only here.
Only here, only that. If you were to describe the headache to me, how does it feel? Like throbbing, constant, sharp, or dull pain?
Trouble.
If you were to rate the pain from 1 to 10, 10 being the most painful and 1 is the least.
8.
Okay, 8 ranges to 10. So, how long the pain lasts?
5 to 10 minutes.
Okay, around 5 to 10 minutes. Does it come, go, or it persistent?
Does it come go?
Okay, it comes and go. What are the events that triggers it, like what you are doing in that moment?
While using my phone.
Using your phone. May I ask, how long do you use your phone?
1 hour.
1 hour, like that. Then do you rest between that time?
Yes.
Okay. What makes your headache worse, like weather, food, or any?
When the weather is hot.
When the weather is hotter. So, Mariel, besides the headache, do you feel any other discomforts?
No.
No, you don't have any cough, nausea, or do you have trouble in sleeping?
Sometimes.
Sometimes. So, you have trouble in sleeping, what do you do?
I drink water.
Drink water. So, the next smart mom is about your past history. I will ask just a few questions about your past. Is that okay with you?
Yes.
So, as an adult, can you recall from your childhood about any illnesses you experienced, like chickenpox? Have you asked your parents before a few times about your immunization or vaccine as a child?
Yes.
So, can you recall what kind of vaccine is this?
Polio vaccine and tetanus toxoid.
Polio vaccine and tetanus toxoid. Do you have any medication you take daily?
Yes.
What medication is this?
Vitamin C.
Vitamin C. Are you allergic to anything else like foods, drinks?
No.
No. And next is your family history. Is there any diseases present in your family?
No.
No. Do you have any family members that has diseases or illnesses?
No.
No. So they don't have like diabetes, tuberculosis, or someone with asthma?
Nothing.
Nothing. No. How about cancer?
Nothing at all.
Any mental disorder? Or heart diseases? No. Lastly, how do you feel about yourself today?
I'm feeling well.
You're feeling well. So do you feel any discomfort beside your headache?
Nothing at all.
Nothing. So may I know who are you living with?
I'm with my parents.
You live with your parents. Good day, ma'am. I am Marvin, Segunla, a student nurse from North Valley College. I am here today to assess your physical assessment. May I know your name, ma'am?
I'm Maria Segunla.
Your birth date,
January 21, 2004.
age.
18 years old.
So for today, ma'am, I'll be assessing your head, neck, and for me able to assess that, I'm going to touch the certain parts of your body, specifically your head and neck. So is that okay with you, ma'am? So rest assured that all the documents and findings are completely confidential with me and the attending physician that I'll be referring you to. So do you have any questions, ma'am?
Nothing.
Nothing. So I just have a quick history, ma'am. Is there any lumps and lesions in the head or neck that do not heal or disappear?
No.
No. How about facial or neck pain?
Nothing.
Okay. Do you feel dizzy sometimes?
Sometimes.
So past history, ma'am. Is there any head or neck trauma in your or injury?
No.
No. Family history, ma'am. Is there your family has a head or neck cancer or migraine headaches?
No.
No. So now, ma'am, we are going to begin our physical assessment starting with your head. So before that, I'm going to hand hygiene and wear my gloves. Okay, the first part of our assessment is the inspecting your face, ma'am. Okay, so I'm going to palpate your head. Is that okay with you, ma'am?
Yes.
Okay, I'll be palpating your head now. Then I'll be checking your scalp. Okay, from the back up. Okay, ma'am, I observe that your head is symmetrical. It is round and it is in the midline. And you are normocephalic, which means your head is appropriate to your body. And I don't see any lesions, scar, masses, or lumps in your head. And also there are no parasites present like lysis, and I haven't observed alopecia. Next one, ma'am, is I'll be checking your facial symmetry or your facial movement. Okay, ma'am, so next, ma'am, is I'll be checking your cranial nerve number 7. Just follow the things I'll tell you to do. Okay, ma'am, can you please raise your eyebrows, please? Okay, and can you please blink your eyes for me? Okay, another one. And can you close your eyes tightly, ma'am? Okay, ma'am, can open it. Can you please Smile po. Okay, and frown po yung ganito. Okay. Next is puff your cheeks po. Okay. And I don't see any abnormalities in your face when I tell you what to do, the movement. And there are no dropping of the face in the both sides, the left, the right, and the left. So both sides are, ma'am, is I'm going to palpate your temporal artery. Okay, ma'am, I'm going to touch it. Okay, can you bite, ma'am, the teeth? Okay, again. So next one, ma'am, is I'm going to palpate your temporal mandibular joints. Here. Okay, can you open your mouth, ma'am? Okay, close. Okay, open it again. Okay, ma'am, I don't observe any swelling and tenderness. So, ma'am, while I'm checking your temporal artery and your temporal mandibular joint, do you feel pain? No, okay. Do you experience any headaches, ma'am, in the past few days? Okay, that's good. Next one, ma'am, is I'm going to inspect your neck using the pen light. Okay, ma'am, can you this? Okay. Okay, ma'am, next is just sip a small amount of water and hold it in your mouth. Oh. Okay, you can inspect it. Next one, ma'am, is just look up. Okay, side again. Flex. Then to the other side. I can see po that, ma'am, is your trachea is in the middle line. And while you swallow, the process is okay. The movement in this part here is normal. I don't see any bulging or swelling in the neck. And while you're sipping the water, ma'am, do you feel tenderness or pain?
No.
Okay, that's good to hear, ma'am. Going to note it. And there are trouble in swallowing po?
No.
No, okay. Next po, ma'am, is I'm going to check your cervical vertebrae. And I'm going to assess it posteriorly. Okay, ma'am, good. Can you look here, side? Then up. Then on the other side, ma'am. Okay po. Okay, I don't see any irregularities while moving, ma'am. Okay po, ma'am, is I'm going to check your neck range or the motion. Can you look up in the ceiling po? Okay, in the floor. The side. Other side. Okay, can you feel any tenderness or painful while moving, ma'am?
No.
Okay, then, ma'am, is I'm going to palpate your trachea, assessing it posteriorly. Okay, ma'am. Okay. This one, I can feel it it's in the middle. So, can you swallow po, ma'am? Okay, swallow. Okay, again. So, I can observe po, ma'am, that your trachea rings are working naman po, ma'am, is just look up. Okay, side again. Flex. Then to the other side. Okay, it's good, ma'am. Your trachea is in the middle. Next, ma'am, is I'm going to auscultate your thyroid gland using stethoscope. Inhale, ma'am. Hold it. Okay, exhale. Inhale, ma'am. And hold. Okay, exhale. I observe that, ma'am, there are no presence of bruits, and I observe that your carotid artery is fine. I'm going to palpate your lymph nodes, so allow me to touch your face again. I'm going to palpate your preocular nodes, which is here in the ear. Okay, next I'll be palpating your post-auricular nodes. Next is the occipital nodes. Okay, then the tonsillar nodes. Okay, your submandibular nodes. And submental nodes. And the superficial node. Next is the deep cervical chain nodes. And the posterior nodes. And next is the supraclavicular node. That's okay, ma'am. That's the last part of our assessment of your head and neck. This assessment we did, ma'am, is to treat the necessary needs of if ever we found abnormal findings. But in your case, ma'am, I haven't found abnormalities. So that's all, ma'am. Thank you for your cooperation and for good health, ma'am. Just eat a balanced diet. Eat regularly. Take your vitamins, especially in this time of pandemic. And that's all, ma'am. Thank you. This is the body temperature using this digital thermometer. Going to sanitize first the digital thermometer using the wet cotton balls from tip to stem using a twisting motion, and dry it off using a dry cotton balls from tip to stem. I ask our patient to raise the sleeve. Okay, ma'am, raise your sleeve and turn it on the digital thermometer. Okay, and put it on in the center of the axilla. Okay, now that the BP sounds and going to, okay, ma'am, get down your sleeve. And we're going to jot down the body temperature in our jot down notebook. And then we're going to sanitize use digital thermometer using a wet cotton balls. But first, turn it off the digital thermometer using a wet cotton balls to sanitize it from tip to stem. Then dry it off using a dry cotton balls from tip to stem. Then we're going to put it in its container like this. Next is taking the pulse rate. So can you rest your arm here, ma'am? First and second, third fingers along the radial artery and press gently against the radius. Rest your thumb on the back of the patient's wrist because fingertips are sensitive to touch to feel the pulsation. Okay, we're going to apply enough pressure to the patient's pulsating artery so the beating can be felt distinctly. Okay, now that we obtained the beats per minute of the pulse rate, we can now jot down it in our jot down notebook. If the pulse rate is abnormal, just repeat it again and record the pulse rate in the jot down notebook. So ma'am, you can put it down now. The next is taking the respiratory rate. Going to take her blood pressure using the equipment sphygmomanometer, stethoscope, jot down notebook, and a pen and alcohol swab. I'm going to explain the procedure. Okay, place the patient in a comfortable position with the forearm supported and the palm upward. Ma'am, put it here. That and this. Just relax it, ma'am. Now that we wrap the cuff of the sphygmomanometer in our patient's arm, we're going and I'm going to mix it. I'm going to take your height, ma'am. Can you please stand here? Since I don't have a height scale, I'm using a steel tape to measure the height of my patient. Okay. Okay, you can move them on. And don't forget to jot down it in your patient's chart. Next, ma'am, is I'm going to get your weight using our weight scale. Can you go here, ma'am? Step on the weight scale. Okay, you can get down, ma'am. Then write it in the patient's chart. Minimize.